So when I was first learning testosterone replacement therapy, I was taught that you need to use a 23 gauge, 1.5 inch needle because the medication needs to get down into the muscle, and the frequency would be at most once a week. Some people taught every 2 weeks or even once a month. Now, in previous videos, I've teased people a little bit about needle usage, but let's be honest, needles hurt. And if I can use a smaller needle less often and that minimizes pain and scar tissue, I'm all about it. So over the years, my protocol and how I do the injections have definitely changed. And today I want to share that with you. So the first thing we can chat about is the needle size. Like I said, I was taught you use a 23 gauge, 1.5 inch needle. And what's funny is I don't even have one of those around. The closest thing I could find is I have a 20 gauge, 1 inch needle. So you can imagine then 1.5 inches that long. At that point, you're basically using a harpoon. That does not feel great. Let's be honest. And the reason we're taught that is because when you're drawing up testosterone, it's fat based. So it's very viscous and it's hard to draw up with anything smaller than a 23 gauge, like a 25 or a 27. So most often you would use a 23 to draw up and a 23 to inject. Now, the first problem with that is if you do use the needle twice, if you use it to draw up and inject, the needle gets slightly blunted. And so it can hurt a little bit more on the injection. And one of the reasons we would use 1.5 inches was the idea is that the testosterone really needs to get down into the muscle. So if you're injecting in the glute, often you have a good inch of skin and fat before you get into the muscle. So a longer needle was necessary. And the argument is that your muscle has more blood flow, so therefore it may be absorbed better or quicker. But the issue with testosterone cypionate and enanthate, its half-lives are 7 to 10 days, so you're actually not trying to absorb it as fast as possible. There may be some argument that if you inject it in the fat, there are lipases there that can break it down. But long story short, as I used another medication called HCG, I saw the study showing that injecting it in the fat was superior. And so I thought to myself, why wouldn't I inject the testosterone into the fat? And lo and behold, we started doing subcutaneous injections. So instead of using that 1.5 inch 23 gauge harpoon, we would use a 27 gauge. And not as quite as small as an insulin needle, but significantly smaller and significantly less pain. And then on the other end, drawing up, what we would do is use a Lurlock. Then on the drawing up end, we would use a dispensing pen that we would place on the medication. And then we would use a Lurlock syringe. Side note, you always know that anytime you're going to draw up, you need to alcohol the top of the bottle. So you would have your testosterone with your dispensing pen, you alcohol the top, and then you would use a Lurlock 1 ml syringe. And then voila, you draw up that way. And as you can see, it's so much easier than using a needle. And an advantage to this is every time you poke your bottle, you are taking the risk that bacteria is getting inside of the bottle. And once it's inside of the bottle and you draw it up in the syringe, you are then injecting testosterone that has some bacteria in it, and then it gets below the skin. It can get infection and cause cellulitis. You want to look up some horror stories, look at cellulitis, particularly, usually it happens for whatever reason in the thigh, and it basically just eats your thigh muscle away. So not a good thing. We want to minimize infection. And that's one of the advantages of using a dispensing pen. And that's why that I've moved over to the 27 gauge 1/2 inch needles and injecting subcutaneously. And now we can talk about frequency when we're looking at a testosterone cypionate and enanthate. Again, side note, I've had people challenge me on this over and over again. Both of them seem to be somewhere between 6 and 10 days. Different papers show different things. I feel like I've seen more papers showing cypionate with a longer half-life, but if it is, it's by a day or two. Both of them seem to be pretty long acting. So what we were taught is, okay, this has a 7 to 10 day half-life. We can inject it every 7 to 10 days or less. We can shoot the levels really high and let it come down. But that just doesn't give us good clinical outcomes. You can imagine a guy whose testosterone levels are going from 1500 to 750, 1500 to 750, like just not fun. You're going from 70 miles an hour to 35 miles an hour, 75 miles an hour to 35 miles an hour. Not fun. So what we would want is something more like going from 900 to 1100, 900 to 1100. So you can do a smaller amount injected more frequently. So instead of injecting 1 ml weekly, you would inject 0.33 mLs 3 times weekly. That would give us a more stable levels of testosterone. And side note, going back to fat versus muscle, there may even be some evidence that when the testosterone injected in the fat, it is actually absorbed slower, also helping keep levels more stable for a longer period of time, really staying away from the peaking and the troughing. And then now location-wise, with the subcutaneous, it does give us a few more options, but as far as ease and pain, I really like sticking with the upper outer glute area. Even right now, I can access my upper outer glute even by sitting. Usually though, I'd have someone standing up and then they shift the weight to the other leg so the glute muscles are not engaged when you inject. Because some people are really lean. So even with a 1/2-inch needle, you may be able to still get an intramuscular injection depending on where you're injecting. But usually when we do the upper outer glute, you basically cut the glute into fourths and you do the upper outer quadrant. Other locations that I find really popular are the middle lateral thigh. So you would divide your thigh into thirds. You take the middle third, and then you also take the lateral third. The interesting thing about the thigh injection is 9 times out of 10, it's very much painless. It's probably one of the most pleasant injections. But that one time, oof, I mean, you get a Charlie horse. Like it's not fun. So I personally don't like the thigh injection. Many people find it easy because you're sitting, so you can just lean over and inject. Whereas with the glute, it's kind of hard when you're turning around and twisting. And I've had it before where I'm injecting and I start spasming and it's like, oh, it can be a little bit uncomfortable. There are some people who really like the delt injection. And that's where I was like, man, with an 1.5-inch injection in the delt, like that's going deep, not pleasant. And I personally, it just could be my own anatomy, especially guys that are a little more muscular or just bigger in general. It's hard to, reach across to try and get over here like that. And again, you can still get cramping in your chest. Some guys can do it, but I'd say those are the 3 most popular areas. Now that we're adding the subcutaneous injection, a lot of people think, oh, why don't I do it around the belly button, just like I would do like an ACG or a peptide? In my experience, and I'd love to hear your guys' feedback, for whatever reason, there seems to be more irritation when the testosterone is injected in the gut. And there's a couple different theories with this, is that this irritation actually could be happening in other places and it's not as visible because like if you're injecting it 1.5 inches into the muscle, you can't tell the irritation. So when you're injecting it subcutaneously, it's closer to the surface. So if there is a little bit of bruising, it's more visible. There is also the idea because fat has less blood flow, there is a higher likelihood that the testosterone sits there longer, that it doesn't disperse and it can form bubbles or kind of blebs. Again, I'm kind of like, well, maybe that's happening in the muscle and we don't really see it. So it is more visible if you're injecting something subcutaneous. You can see the skin raised due to the medication being closer to the surface of your skin. Now, because of that, you probably say, well, Dr. Moeller, if we can do subcutaneous injections, why wouldn't we use something like an insulin needle? Yeah, right here, I have a 30 gauge, 15, 16s. Like, yeah, that's tiny. These are very, you would hardly even feel that. However, the issue is you can't remove the needle. So that problem with being able to draw up a viscous fluid like testosterone does happen with these smaller needles. Now, I do know some guys who will go ahead and use the insulin needle and slowly draw up. It takes forever, minutes. I almost want to say hours. Like it is a slow drip. Like if you want to get to like 0.2, 10, 15 minutes to draw up one syringe. And I've had guys tell me, well, I just put on a movie and I draw it up. It's not really a big deal. So to each their own, because, that's a small needle and the injection is very, very painless. Now, and something else I recommend really going against, but a lot of people do and is super popular, is called backfilling. Now, the idea here is you actually go ahead and you remove the plunger, and then you can go ahead and take some testosterone that's like filled up in here, and then you'll just, drop it in. You're backfilling. And then you have to re-put the plunger in, and then you have to turn the air upside down, and you have to flick it out. It's more of a process. Now, the part that I'm most skeptical of as a doctor, and, none of this is medical advice. This is just what I do. You should work with your practitioner to make sure that you're staying safe. But what I don't like about this is when you're opening up, you're minimizing your sterilization. And as I'm dropping the testosterone in, I could cough in this area here, and I'm allowing the testosterone to be exposed to more bacteria. So again, if there's bacteria that's in that testosterone, your skin is there for a reason. It's your immune system. It's a barrier to keep bacteria from getting underneath the skin where everything is very vulnerable to bacteria. So we don't want that. Now, a lot of guys do this, but again, I would recommend that you watch some horror stories on cellulitis and infections that happen from using improper technique. So again, earlier I chatted about making sure you're swabbing the bottle before you draw up, but also swabbing every time before you inject. Like there's no reason to not be doing that. It's super cheap. It's super easy. It's super fast. And you don't want a case of infection or cellulitis. Like you can go septic. You can die from it technically. So why take the risk? So there you have it. My personal injection techniques with my guys is most often we'll start using a 27 gauge 1/2 inch needle, injecting small amounts 3 times a week, and sometimes up to every other day or daily, depends on the person. And that's why really you should be working with a healthcare practitioner to find your perfect way to inject testosterone replacement therapy and peptides and other medications. So I hope you found this information helpful, and because you made it this far, I think you'll enjoy this video. Until next time, stay vigilant, my friends, and God bless.